our participants, some of our participants, to come up and present about their local DHIS2 implementation stories. So I would like to hand it over to Michael to facilitate this session. Michael.
Thanks, everyone. For those of you that don't know me, my name's Michael Buttsworth. I do a couple of days a week for the University of Oslo, and I predominantly, well, I help out in the Pacific with the coordination of DHIS2 implementations. Today, or this morning, we're going to have 4 presentations. The first one from Papua New Guinea, second from the Maldives, third from Cambodia, and then we'll get UNFPA Afghanistan to present as well. And yeah, I know we haven't had a lot of time for questions and discussion, so we'll try and move through fairly quickly. I do encourage, if we do get time, to ask plenty of questions, because I think this is a real learning opportunity, seeing what other countries are doing. But if not, make sure you meet up in the coffee breaks, the tea breaks, and ask plenty of questions there, because I think that's the real value in these sorts of conferences. So as I said, I work in the Pacific, and this year unfortunately, we didn't get a lot of the Pacific Island countries here. Last year, I think we had Vanuatu and Solomons, who have full-blown HMISs using DHIS2. But this year we've got a new user, a new country, PNG, Papua New Guinea, and they were able to attend. They've very much started their journey with DHIS2. They have a very good system in place at the moment, but they're using or looking to explore DHIS2 initially on the periphery for certain implementations. So I'll welcome Mr. Pius up to give Papua New Guinea's presentation. Thank you.
Thank you, Michael. Everyone in the room, good day to you all. Thank you for the organizers for giving us this opportunity to present. And thank you, Michael, for making it possible for us to travel all the way from PNG to here. I have a very short presentation. As Michael has said, we are new to introducing DHIS2 into PNG. So I'll be presenting on DHIS2 pilot for reporting and data sharing in PNG. I have Mana with me that we travel from Port Moresby. Sorry. Oh, okay. Whatever activities, initiatives that we do in digital space, we follow the National Health Plan. The current National Health Plan 2021-2030. In it, we have 200 indicators that we must achieve from the national to all the way down to the facility level. Just sorry. Please. Sorry about that. We have a M&E framework that is aligned to the national plan. So our M&E framework has 136 indicators. That's for annual reporting, and 64 indicators measured for periodic reporting. So in existence, we have the eight digital systems that's collecting data. The main system that we have is the electronic national health information system that is collecting service level data. So that's the reporting pathway. The diagram is not very clear. From facilities, they report up to the provincial health authority, provincial level, and then to the National Department of Health. So it is a primary system to collect health service data, as I've said. Discharge hospital information system data is also collected, and we also report medical supply system data, HIV, TB data as well into the ENHIS. So we have introduced DHIS2 into the provinces. We have 22 provinces, but we are piloting DHIS2 in one of the province, and it has shown to be a successful pilot. And this is it strengthens the linkage between resource allocation and accountability, use existing information, resolve the lack of transparency and availability of strategic information. And this is burden on timely reporting. So that's the intervention using DHIS2 for the 22 provinces that we need to scale up. So this is the dashboard. These are some of the data visualization that's happening with the dashboard that's been implemented. We have different systems. Data has been collected and then integrated into DHIS2 and analyzed in the using intelligence tools. So that's the data architecture that we have with the technical assistance from Impact Health Project. So from the dashboard, we have shown that it is shown that there is success, and the department is willing to scale that up to other provinces as well. So we are getting assistance from HISP Vietnam to do this project. So our next steps is to complete proof of concept and dashboard toolkit next week, like from October, and the minimum viable product for PHAs. So we want to expand to other provinces as well. It looks at data integration, finance data, supply data, HR data, ENHIS data, and supervision checklist data. So all this data has been integrated. Instance hosting will be decided, and training should proceed with the expansion as well. I think that's just about implementing DHIS2 in PNG. We are, as I've said, we are new to DHIS2, but we are seeing the benefits from your presentations. We are already seeing benefits what DHIS2 can do for us. So we have piloted it, and then in one province we have seen the result of it. So I think the next steps is to scale up DHIS in the country. Thank you.
Thanks, Pius. Maybe just stay up there for a minute. You can't get out of the limelight that quickly. Just if there are any questions for Pius, please ask away. So just while people are having a think, I think PNG's has quite a good system in place, but it works very well because PNG is very, very remote. Very remote. Some areas are very, very hard to get to. And the system, the ENHIS, works quite well, but that's because there's been a lot of investment there through ADB. I think when they initially set the system up, they flew helicopters out to facilities to do trainings and things like that. And it's working well, but I think for some things, it's not perhaps as flexible as they needed it to be. So they're exploring DHIS2 for some aspects, so for COVID-19 surveillance as well, and they've looked at HIV. But yes, this PHA dashboard's really about integrating and presenting something that at the provincial level, so the administrators can view data from multiple systems. So it's very much an integration type project. So
yeah, I'll just add on to that. DHIS2, some of the non-government organizations are using it. One of them is FHI 360. So what we are trying to do is in the FHI 360 DHIS2, it's got the COVID-19 data. So what we're trying to do is integrate that with the dashboard. And also we are looking at the program level data. The ENHIS reports the service level data. So for each program, we want to use DHIS.
thanks. And one quick thing, unless there's any questions, was just, yes, World Bank is very much supporting that project, and we very much thank World Bank for helping support Papua New Guinea to attend this conference. So thank you, World Bank.
Yes.
Any questions? No? Okay, we'll move on. If you think of anything, feel free to ask. Okay, the next, did you want me to talk now? Anu, introduce the next country? Yes. So the next country, I believe, is the Maldives. Yes, so Maldives. And certainly while they're coming up, I know there's a lot of similarities with some of the Pacific Island countries too, with the Maldives, just that remoteness and small island states. It's very different to what we heard earlier with Pakistan, Bangladesh, etc., where there's very, very big populations. Okay, over to you.
Good morning, everyone. Again, I'm Difana from Maldives, from Ministry of Health. So in this presentation, I am talking on enhancing sustainability of DHIS to best public health management systems in Maldives. So these are the key points that I will be highlighting in my presentation. First, moving into the modules we have currently implemented and we are currently using. So this includes a routine health information module. This is the first ever module we started using in Maldives. This was in July 2019. In this module, we are collecting routine statistical information from public facilities and private hospital as well. And then we developed, we piloted this electronic immunization registry on October 2022. In this registry, all the vaccines from birth to death we are recording. And then we have our primary healthcare registry. We piloted this in one atoll first in March 2023. In this year, we have expanded, and now 2 more atolls are using in this registry. And through primary healthcare registry, we are monitoring disease progress and the disease disease status. And then we have National Cancer Registry. We started using National Cancer Registry on November 2023. In first, we are starting this in two facilities of Maldives, two biggest facilities in Maldives. Uh, from one facility, all the legacy data starting from 2019, they have completed entering, and now we have started to enter data from the other facility as well. And in the National Cancer Registry, we have individual cancer informations. And then we have lymphatic filariasis surveillance module. This was started on February 2024 to screen for mass screening of filaria. And Importantly, this module was developed in the Maldives by our team, those who were trained for this, and we this module was developed within just 2 weeks for this mass filaria screening. And then these are the modules we have prepared for piloting. So I want to say that these modules were ready, but because of server compromisation, we were unable to start. And these modules includes communicable disease surveillance. In this module, we will be notification and investigations of communicable disease. And then we have maternal health module, antenatal and postnatal care will be capturing. A growth and developmental module, we will be capturing growth and development of children age up to 5 years. And then tuberculosis screening module for mass screening of TB, since we are working towards uh, zero TB elimination. And these are the future commitments we have in this. Most of the modules we have finished the pilot scoping also, and those includes in tracker-based system, injury surveillance, a mental health module, and thalassemia and donor registry, a port health one, and migrant health for migrant health screenings. And in aggregate funds, we have family planning and mm, and we want to migrate the Excel-based inpatient diagnostic report to a digitalized one. And also we are redesigning some of the modules that we are currently using in the DHIS2. Those includes laboratory and diagnosis reports, surgery reports, human resource status reports. And I will go through some bottlenecks that we have identified for sustainability to make this sustain. So those include the limited capacity of the local workforce. As a result, now we are currently relying so much on the external experts, but we are trying to, and we have already trained so many staff from Ministry of Health in 2023. As a result, these trained staff are actively involving in the development of the modules and uh, other things. Those staffs includes program level staff as well. They have involved actually in compilation of metadata of growth monitoring modules as well. Then we, oh yeah, then we have a need for interoperability. So currently we have so many standalone systems in place in Maldives, but none of the system talks to each other. So we have hired consultant with the support from WHO to assist in the API integration work. So then in this API integration work, first we are targeting to the major facilities in Greater Amala region. Now the mapping tool has been finalized, and facilities will also make changes, required changes for the missing variables. And and before the end of this year, we are targeting to bring one facility from Greater Malay area to bring on full automation. And we have auditing, data quality, maintenance, and user support. User support current even with the limited staff uh, and resources, we have taken steps to ensure data quality and provide ongoing user support. Provide a timely user support. We also have to plan to include a ticketing module or utilize DHIS to messaging uh, features as well. So our target is to enable a systematic auditing and feedback mechanism in near future. So to maintain server capacity, at present our servers are based in another another ministry, under another ministry. So we impose challenges in daily monitoring of server capacity, performance, and to maintain the server capacity and performance by our core team, which is based in Ministry of Health. So we are working on getting access to server monitoring tools. So the need for creating a shareable electronic health record. This is one of the missing piece actually, which we need in Maldives now, because we have around over 180 facilities directly under Ministry of Health, and at present shareable electronic health record is not available. And we believe that most of the clinical information that we capture from the systems are relevant to DHIS2 modules we have. And with the support from WHO, we are working on establishing an EMR development work. And this will link to an electronic health record, and we are planning to initiate this year. This electronic health records will be integrated with the DHIS2 modules that we currently have. So to enhance data use, data use training has been planned from this year onward for the data entry users and policy makers. And one of the main thing we are working on is creating a public portal for, and we are giving public access to view their information. So in first phase, we will provide them growth monitoring charts, EIR records, developmental milestone check-in, and primary healthcare records. So let's have a sneak peek at the public health portal that we have. This is the electronic immunization record. And from this, we can also print a digital vaccination card. And we are also, once we have started the to capture the travelers' immunization records, we will be, they will also be able to have a digital vaccination card for the travelers as well. And this is the growth monitoring chart. Uh, and, and this is from the growth monitoring chart. Actually, they can also view their values as well, and they can, and also this was made it, actually this growth monitoring chart and developmental milestone we have made as how it looks like now on their current book, so that it will be easier for public to understand, and their acceptance will be more. And this is the developmental milestones record. from this record, when now the thing we are working is once if there is a missing milestone of a child, we are working on a red flag mechanism by enabling the notifying tool in the DHIS to inform other ministries so that they will be able to find the children who have delays in developmental, so that prompt action will be taken by referring to other doctors specialized care. And vitamin A and deworming, this is the primary health care record. We'll be able to see how many visits the patient visit, monthly visits, if their diagnosis and their other examinations as well. So these are our technical partners. Thank you for listening.
So thank you so much. I'll stand away. I know I listened to the Maldives presentation last year at the conference and was impressed, but obviously they've done a lot more work now. So that's very impressive. Any questions? I think everyone might be getting hungry for lunch. There's a lot presented there. A lot of new initiatives, which is great.
Yeah.
A lot of new plans as well.
Feel free to ask any question around later. Yeah.
Just one question about the mass campaign, like you're using the mass campaign for using the aggregate module, or is it like how we are trying to implement that? Because most of the countries, they want to try to also start with mass campaign using the DHIS too. So my question is, are you using DHIS for mass campaigning? And then like, what is the suggestion for other countries, how they can try to adopt the mass campaigning things which you have implemented in Maldives?
Currently, we had our file area mass campaign, which is a tracker-based module. We track the patient. So it was very easy for us for that. Actually, in the file area campaign, most of the information were collected from the migrants and then Maldivians, because local people, and because this disease was notified from their side, and yeah, it is really useful, and we made this module within just 2 weeks by our team. We were able to know the timely updates and like the statistics and everything to take immediate action.
Did you have anything else, Pamela, to add, or?
And it's quite contextual because Maldives is a small population, and they have, I mean, the level of infrastructure that they have and the health facility network is also quite unique. So given that they were able to do it at individual level, but in a different country, of course, this may not be so feasible.
Yeah.
Okay. Any more questions? It's bright lights here. I have to struggle to look out. Any more questions? Okay. Thank you very much. A round of applause. Great presentation. All right. Now we'll have Cambodia, please, a representative from Cambodia to present.
Thank you, Mr. MC. Good morning, everyone, again. I think we are still in the morning. So my name is Yang Wan Ra. I'm from WHO Cambodia. Today, I'm representing our delegate from Ministry of Health, talking about our health information management information system in Cambodia. So talking about DHIS2, Cambodia is not news to the system yet, but yet it's not very popular in the country. So we use it since 2013, and then for our indicator-based surveillance system. And currently there are other few programs that are using it. So today I want to present you about the current health information management system that we are using now in the country, but not DHS2. So I will present about the current HMIS, a little bit about the health structure and the data reporting flow for your understanding. And I will talk also about the assessment that we have conducted last year, and also the needs for the country to transition the current HMIS, and also the next step that we will do to enhance our system. So talking about the current HMIS in Cambodia, it was built locally in 2010 based on the PHP 5 and MySQL also version 5, which is very old version right now. And it has been rolled out to all the public and private health facility in the country, from national to health center level. So currently we use it to collect data, aggregated data, and then the system can generate a simple report. However, there are still limited of data visualization in the system. I think similar to other country, different health program have their own platform. They also collect data on aggregate format and also a case-based format at the health facility level. For the HMIS, we currently have around 100 indicators, and we plan to add more 68 indicators following our health strategic plan for this year. In addition to HMIS, the WHO have support Ministry of Health to develop what we call National Digital Health Strategy 2024-2033. Actually, we missed one. As part of the ASP4, the idea is to to collect data from different disease programs and to ensure the interoperability, scalability, security, and sustainability for the HMIS. So if we talk about health structure in Cambodia, I think similar to our neighboring country. So we start with Ministry of Health, which is at the national level. And we have one department responsible for HMIS, which is the Department of Planning and Health Information. Below National Ministry of Health, we have Provincial Health Department. So in Cambodia, we have 25 provinces. So we have, again, the same number of the Provincial Health Department. Below the Provincial Health Department, we have Operational District, which we have right now around 103. Below the Operational District, we have Referral Hospital. It's kind of district hospital. We have 96. And below Operational District, we have also Health Center, which is the primary healthcare level. We have around 1,300 health center. And in addition, we have also private and NGO health facilities. Forgot to mention about provincial hospital. We have around 25, which under the management of the Provincial Health Department. And also national hospital, we have around 12, which is managed by the Ministry of Health themselves. And we have also national program. And in Cambodia, currently we have around 17 million population. In terms of data reporting form, so at the hospital level, referral hospital, provincial hospital, and national hospital, we have one form. We call it HO2 form. for this facility to report every month. So it's a monthly reporting aggregated data system. And at the health center level, or we have one more form called HC1 form. And for the private and NGO hospital, we also have another form to be reported. So talking about the HMI assessment between 2022 and 2023, we have identified several challenges related to the current HMIS system. First, it's about the fragmented system. So the current HMI is working in silo. It doesn't connect to any other national program data system. So that's create a lot of issue in terms of data sharing and also the quality and timeliness of the information. As mentioned earlier, the current system is based on PHP5, which is very old technology comparing to the current system, which already in the PHP8 or later. So this create a lot of issue in terms of sustainability and upgrade, or and it create a lot of challenge when we want to improve the performance of the system. And the system currently doesn't support mobile interface. We can use only on a computer platform. In terms of data analytic, we have limited function for data analysis and visualization. So we can generate several kind of report, but still it's not enough. So as mentioned also earlier, the different program create their own system in addition to the HMIS. So it create a lot of the duplication of data entry at the health center level. So it create a lot of burden for health staff to report the data into different disease program plus the HMIS. Since it's a local bill system, and we have limited resources at the IT resources at the national level. So the cost to maintain the system is quite high, because especially when we want to improve the system, we want to add new indicators or remove indicators, we need to do to change the program, and you need IT developer to reprogram it to make it happen. And this also take more time and effort. Lastly, we found that the data validation is still also limited, because in the system we just allow them to enter, based on what we have requested to submit, but in terms of data checking and validation is not available in the system. Following the assessment, the WHO recommend two options for Ministry of Health to consider. So option one is to switch to a new, brand new system for the HMS. And second option is to upgrade the existing platform. So if we choose option one, so that we discuss about some pro and cons about these two options. So if we upgrade to the new system, we need to work on the interoperability and data standard, which we need to develop more API and data exchange protocol to get data from other system without doing duplicated work. And we need to prepare for system replacement, which the one option that we think about is to use the HS2, so that we can enhance our data visualization and also interoperability, and also user interface, which as we know, we can use both on mobile for the HS2. If we use the new system, we need to invest more on the capacity building, because the system will have different interface, different kind of usability. So it requires to retrain all the users that are currently using the current system. So that will cost more, and then will take more time. So I think for the option 2 is to upgrade to the new, to upgrade the existing HMIS. But I'm not go through this option because it seems like currently the Ministry of Health already choose the option 1. So I think you can read through this recommendation. Yeah. So for the HMIS in Cambodia, I mean the new HMIS that we want to have, so we want to focus on a new system that have a capacity to interoperate with other systems, such as electronic health record, and also to support data exchange. So we need a system that can do more data analysis and also reporting. And we want something that can be generated or created by users themselves without requiring programming language. And also it will be used to support decision making at the bigger pictures. In terms of functionality and customization, yeah, we want to be able to customize the system to support data entry and data retrieval, enable also the usability in the mobile platform. Yeah, and especially it's easy to customize. Like we want to add, we want to change, we want to update, or we want to delete any indicators as we wish. Because as you know, the indicators might change from year to year, depend on the needs of the country. So we can be, I mean, at the user level, we want to be able to do it. In terms of data storage and management, we want to have a secure location and also centralized platform that can be maintained and in a secure place. And especially we need to be able to do it a data backup on a regular basis. And in addition to this, the data security and privacy of the information need to be available in the new system as well, especially related to user authentication, data encryption, and audit trail in the system. So we need a system that can support decision. So we want a system that can generate alerts and also provide some kind of prediction compatibility for the policymaker or I mean manager, so that they can be timely informed about the evolution of the of the data, and then can take the right decision. Also, because I think the staff turnover create a lot of issue. We need to retrain them again and again when there's a lot of movement in the health workforce. So in the new system, we want something that have training and support built in the system, so that user can follow or can like replicates their knowledge to others easily. And also, lastly, we want to have a system that can do also can support also the monitoring and evaluation. So a tool that can track the program performance, and especially to measure all the indicators for their efficiency. So in terms of next step, we just come back from Oslo last 2 weeks. We had a fruitful discussion with our colleague over there, and we have a draft of a transition plan, action plan. And then next step is to endorse the plan so that we can start our following step. And right now, we will continue to discuss with our HISP Vietnam on the system configuration. Part of the work plan as well, we will establish the core team and build their capacity on DHS2. Also, we will have to revise our current indicators because I think the current indicators are not up to date, and there might be some news, and there might be some old indicators that are not used. So I think that's the more important, because even you upgrade to the new system, but the data is not used, then it doesn't make sense to have a new system. So make sure that we have up-to-date indicators that are usable by all the stakeholders. Next is to update the health facility master list. I think the Ministry of Health already working with WHO, with Chai, with other partners to update this list right now, and we are almost finished. And I think there's no issue in terms of using this data when we move to DHS2. With that, soom ơnคุณ, cảm ơn, and thank you.
Thank you so much. Yeah, that was a great presentation, and I think probably familiar to quite a few people, that transition to DHIS2 and the decision-making process around that was very interesting. I think moving towards something that they feel is sustainable, moving on into the future. And it's also good to see all those those thoughts around the building blocks and getting very prepared for bringing in DHIS2 as well. So are there any questions on that? Great, we've got questions.
I'm Javindra Pandey from Nepal Ministry of Health. Thank you for your nice presentation. You said in your presentation that there is a digital health strategy in Cambodia. And in that strategy, there is interoperability system also. You said that. Is the interoperability system is within the health system or any other systems like social welfare system like that? Is there any interoperability between health that DHIS and other systems of government and non-government?
Yeah, I'm not sure I understand correctly, but let me try to answer. Also, our colleagues there might be able to answer. So we developed this strategy in 2019, and now it still has not been endorsed yet at the moment. And in the strategy, there are several strategic directions. So one is about interoperabilities. And we in the strategy, we said we will establish a CAM-HEA, Cambodia Health Enterprise Architecture, which lay out all the different system in place, starting from the case-based aggregate up to the national level. And in this health enterprise architecture include the non-health sector as well, like COPS, IPPS, identification, I forgot the full word, insurance as well. So there's all the system in place, but since the strategy have not been endorsed, so it's still a room to add more. And as you know, we developed it in 2019, so it's quite outdated right now. So we need to revise it a little bit.
My question is, what going to do with the old data since you're moving to the HIS2? What about the old data? What going to do?
I think there was an agreement that we have to migrate all data to the new DHIS2 if we will be planning to do so. And I think HISP Vietnam is willing to help us on this. I know it's going to be a huge challenge to migrate all data, especially in the current HMIS. We have three versions already for the in terms of the backend system. So version 1 might have different structure. If version 2 might have different structure to version 3. So it will be a challenge, but I think we hope we can try our best to migrate the system, and especially we will migrate during the transition as well. So it might take time, but you cannot stop them from sending data. So it's like we need to have a better plan for that.
Thank you. I know you did the presentation on the assessment. I would like to ask if there is a digital health maturity assessment been conducted across the provinces to see the maturity stage before you migrate to a new system.
The maturity, right?
Yeah, a digital maturity assessment, has it been already conducted together with this assessment?
I think this initiative was supported by Wipro, our regional office in the WHO regional office in Wipro. Actually, government did not do it, but we, as the WHO, we did it, like this maturity assessment before the HMI assessment. But I think the result was not like published or share in the public because we lack a lot of documentation, especially, you know, when you do this assessment, it requires some evidence, documentation and all that we don't have on hand. So we didn't share the result actually.
Okay, great questions. I think, yeah, just for your information as well, there is a DHIS2 maturity assessment as well, and I think there's a presentation on that or some information on that later as well. If there's no more questions, I'll move on. But that was, oh, sorry.
That's good point because the maturity assessment that I just mentioned is about the digital health in general, not DHIS2.
Yes,
Yeah.
yes, yeah. Great. Well, a round of applause for Cambodia. That was excellent. And then final presentation for this session is UNFPA Afghanistan. So I'll invite them up to the stage. Thank you.
Thank you so much and good afternoon. I would like to present the UNFPA Afghanistan country implementation of DHIS2. So there is HMIs, so I am just leaving that part and how the UNFPA have implemented the DHIS2. And taking this opportunity, I'm also sharing the future, our future plan. And as all the experts are here, so I will also then learn from them then how we can move forward. So before going forward, we will be, the outline will sharing the mission of UNFPA in Afghanistan. So I know that most of you will already know, and what services UNFPA is providing in Afghanistan, and also how we have implemented DHIS2 within the UNFPA country office, and what is our future plan and also strategy that we are going to. So I think most of you know, so the UNFPA missions are all around the world, but there's a little bit change in Afghanistan. So is to promote the protect of reproductive health and right of individuals, especially adolescent and youth in Afghanistan. But there's one thing changed because UNFPA agency is a development agency, but in Afghanistan, because of the current context, UNFPA is also providing humanitarian support to the flood affected area, to earthquake which happened 2023, mini flood in 2024. So now I will just go to the national boundary and National Geographic. So so Afghanistan have the geographically 8 region and 34 provinces, 426 district, and public facility. I've just mentioned about the public and 4,553 public facility. And what UNFPA is doing is active in all the 8 region, 34 provinces, but in 290 districts. And we have 935 facility, which we call service delivery point. And the important thing is that UNFPA is providing services at the remote area in the community. So we have a FHH, which is called Family Health Houses. We have mobile health team, which providing services at the white area. We have other services in psychosocial services or GBV. So we'll come to that. So overall, UNFPA in Afghanistan is providing services in maternal and reproductive health. As I mentioned, humanitarian because of the current context of Afghanistan. And we are providing services to adolescent and youth. So how we have implemented DHIS2. So I want to be very concise. So I will focus on the last part. So also I can share what we are planning to do. So we have integrated all humanitarian services into DHIS2, maternal reproductive health, GBV, adolescent and youth, and midwifery helpline. And what we wanted to achieve is what is the goal of DHIS2. So this is what we did in Afghanistan. So we want to have a data collection, and this all data is we are collecting aggregated level. So we have a data set for it, and also we have implemented a validation. But beside the available validation, we have also customized our data set for the different type of facility level. So if one facility is providing one services, the other indicator is automatically disabled. And also for data analysis, reporting, and data visualization. And one thing we have done another, so we have a lot of donor, as every U agency have. So for the donor purpose, we have linked our DHIS2 through API to our Power BI dashboard. So our donor can have easily access to it, because you know that the data used for the donor at that level, that how to get the data, how to extract the data, how to know. So we have linked our DHIS2 through API with our Power BI dashboard. Shortly, I will just show you quickly the dashboard also. So I'm quickly just showing. Sorry. Okay. Can you help me with the keyboard? Sorry, it's a kind of it's good. It's good. So we have a couple of dashboard. We have done all the part of creating indicator for our analysis, and we have a couple of dashboard, a general dashboard which are showing what is the number of beneficiary that we are reaching at the community level, and also we are capturing this information by demographic, like the host community Afghanistan are facing internal displaced people and also returnees. So we are also tracking by indicator the services that we are providing, all those information. So I'm just quickly going through, so I don't take much time. So we have all those information, and also beside that, we are also capturing PWD people, the services that we are providing to people with disability. So we are also capturing that. So we have like this is 2024 report. So the number of beneficiary we have reached, PW beneficiary we have reached, and also the map we have used. So we have utilized all those services. And as you can see, we have a different level of access to our user, to our implementing partner. For the humanitarian, as you can see, we have a separate dashboard for humanitarian, and we have a dashboard for population. We have also integrated psychosocial service because the context of current of government, the GBV is kind of a sensitive issue. So we have converted to psychosocial services. So we have over 110 service delivery point or clinic where we are providing psychosocial support to women by women. And we just changed the name to psychosocial support. So the service is almost a psychosocial support to all the target beneficiary. So reproductive health and all those. So coming back to the slide. So this is the one we have done in DHI store. And in the Power BI, I will just quickly go through that. So we have link over DHI store to the Power BI because that is easy. They don't need a login and just easy filter. We have put it there. And we can see easily this is the target audience for this is a donor. So they can see what is the target population in Afghanistan, which is in need, and also the reproductive women and currently pregnant women. If I come here to another part, so we make it very easy for the user or for the end user. So they can filter by year, by month, by program, by province, by donors, by IP, which IP. So they are easy to switch between the data, get the data, share the information, or even validate the data when we are providing report to our donor. So this was just a short view. I'm going to the next one. So what is our future plan? This is very important, and I want you to support us, all the HISP community in Asia and also Oslo. So now our next target is we've already achieved aggregated data. So what we are planning to do is we want to ensure that all UNFPA facility are connected with internet connection. One thing. Another thing is we would like to collect individual level data. So now we are collecting aggregated data, but we want to collect individual, who is the beneficiary, with very basic information, but individual and for what purpose they have visited. Because most of our beneficiary are women, over 80% is women. You can see the link of Power BI, you can see play around the data. I think it will be shared shortly. So, and also one of the most important part, we are providing immunization service in this delivery, and they have that immunization freezer. So we would like to connect that freezer with our system DHIS2, so we can get the real-time information that what is the status of those freezer, whether it is within the threshold, the temperature is above, the temperature is low, whether the facility have problem with the immunization freezer, so they can notify us on that. And one of the challenge that we are facing at the moment, we are thinking about that how we can address that is the real-time data. We are calling DHIS2 because the analytics run maybe in 6 hours. We can schedule it in 24 hours, but minimum we can schedule it in 24 hours. But how we can get the data in the real time? Because we are connecting all the service delivery point, and we will be providing all the equipment. We are planning for tablet to provide all in the facility, and we will be training them. And we will be, once the beneficiary has been added, it should show on our control room so we can know what is the number we have reached. And most important part is how we can have the information and the immunization freezer. So whether if it's not functioning, we should know, and we should contact and support the area or that SDP. And if it is above, if it is low, so how we can do that. So this is our future plan to have those implemented. So I was just very concise, sorry. I just wanted to have some session for a question and answer. And I will be reaching you out so we can see that what will be the solution that we are planning next.
Thank you. Yeah, no, concise is good. A round of applause. Yeah, concise is good. We will like to get to some questions. So are there any questions or even comments? Because there are a few questions that you had as well. So
Thank you very much for a very good presentation and having us an overview of what actually UNFPA is doing in Afghanistan and how UNFPA program has transformed to DHIS2. But you know, in Afghanistan, uh, we have so many districts and health facilities and so many partners and donors like UNICEF is supporting health facilities, maybe other organizations. So, I mean, do we have a plan in Afghanistan? This is a very general question, not specific to your, to transformation at the national level to DHIS2. Because what you have presented is basically what UNFPA is doing, that is converted. So other organization or other health facilities at large, what is the situation of transformation or transitioning to DHIS2 in Afghanistan at the national level, not specific to different partners? Thank you.
Yeah, thank you so much, Inam Saib. So this is why I've mentioned early that I'm presenting what UNFPA Afghanistan is done in implementing. But thank for asking this question. Afghanistan have implemented DHIS2 at the national level in 2016. So we had implemented DHIS2 at the national level, which I have mentioned, even the SDP that we are supporting also reporting to the national HMIs. So we have at the national level where every service delivery point or every facility have to report their standard aggregated report monthly, or we have for COVID-19 response, we have a surveillance, and we have for other immunization purpose. So we have a very detailed DHIS to implement it in Afghanistan. I think that will be take much longer, so I can go through it. This is why I just focus that why and why we are. So maybe the next question will raise that why we are implementing our own. So there's two reasons for it. The one reason is the current government. So the way we are implementing it, so we would like, because mostly we are delivering services to women, and especially in gender-based violence, psychosocial. So we don't want to share the information because they may affect our implementation. The next thing is that the aggregation that we are collecting, like as mentioned, demographic we are collecting, the level of IDPs, returnees, and also PWD. So at that level, the information is not available. At that disaggregation, information is not available in the national HMIs because they have another disaggregation, age disaggregation. We also have age disaggregation beyond that. So Afghanistan have implemented DHIS2 almost 7 years ago, and it's been abroad at every level. Even we have implemented at the private hospital, it's planning now, implemented at all level. Thank you.
My friend, my question concerning Power BI, is it online connection or it's offline? Power BI.
No, it's online.
It's online.
It's
huh?
online. I hope they will share the presentation. And one thing is important to mention because this is over for a donor purpose. This is why I've just presented here. So the Power BI is online. They don't need any credentials. So this was the reason for a person who is not used to the DHIS to how to get the information, like but different category, different dimension. So we made them easy for it. So they can just filter and get exactly the data which is available on DHIS2.
This is good to have this experience to be published to everybody to know how to do the connection with the Power BI.
yeah, so certainly I know other countries have attempted to do that, to link. My colleague was just saying that it would be good to have that experience about how to link to Power BI. But I know in some countries they link to other external platforms as well. Yeah. Any more questions? Or did anyone else have a comment?
I would appreciate any comment for the last part or next plan. I would really appreciate that.
Okay, well, if there's no more questions or comments, another round of applause. Thank you. That was a very interesting
Thanks so much.
presentation.
Thank you. Thank you.
And that's it for this session. I'm going to hand back to Anu. And yeah, I think we're almost at lunch. So over to you.